Good afternoon, everybody. Thank you for joining us for this afternoon's COVID-19 Professional Education Quick-N-R. My name is Matt McDonough, and on behalf of myself and all of us at the ESRD NCC, I do want to welcome you to this afternoon's event. Before we do proceed, I do want to make note that today's event is being recorded, and recordings of these events are typically posted to our website within 48 hours, although we tend to get them up there a little bit faster than that. So let's go ahead and proceed to our next slide, our agenda slide. So what is this call about? We'll talk about that. What specifically is this call today about? And then we'll introduce our speakers. We do have Keely Lenoir with us, as well as Beverly Whittet. And they're going to talk to us a little bit about helping patients and providers prepare for hurricane season during COVID-19. Obviously, COVID-19 introduces a new wrinkle into what is an already active hurricane season. And so Keely and Beverly will be sharing some tips with us on preparing for that season. And then as our event goes on today, we would love for you to submit any questions you may have, either using our chat panel or our Q&A panel. You don't have to wait to the end to submit them. We invite you to submit them to us at any time. We will accumulate those questions throughout today's event. And as time allows at the end, we will ask our SMEs to answer those questions. And we'll get to as many of them as we can today as our half hour allows us to. So what is this call about today? This is an opportunity for us to hear from stakeholders and SMEs that are in the community on how COVID-19 it is going to impact potentially your preparations for the 2020 hurricane season. There's a lot going on out there. If you're in the Florida Gulf area or the Gulf of Mexico area at all, you know we've got a storm churning out there. So how is that going to impact our planning efforts this year, along with COVID-19? We'll get some real-world strategies for facilities to put into use. And again, this is a series of weekly calls on a variety of topics that are whatever's pertinent is what we're talking about, as an example is today. So let me go ahead and introduce our two speakers today. Keely Lenoir is the Kidney Community Emergency Response Program Manager. Keely has over 12 years of experience in the field of healthcare emergency management. She is experienced in all aspects of disaster preparedness, and that includes planning, training, evaluating, and response. Keely's worked closely with partners from across the country to support the development, the implementation, the evaluation, and improvement of public health across all phases of emergency management. Also with us today is Beverly Whittet. Beverly is the Special Projects Director for ESRD Networks 7 and Network 17. She's also the KCER Coordinator. Now, Beverly has more than 20 years of end-stage renal disease nursing experience, and that includes 8 years as an ESRD network employee. She's very knowledgeable in ESRD emergency and disaster preparedness and management, as well as patient and provider education. It gives me great pleasure to turn things over to Keely.
Great. Thank you so much, Matt, and thank you to the entire NCC team for allowing KCER to participate today in the Quick-N-R series. I also want to just take a quick moment to thank all the attendees for joining us today to discuss this very important and timely topic. If you could go to the next slide, we're going to start off today's presentation with a very quick video from the National Oceanic and Atmospheric Administration. It's just a quick overview of their predictions for the 2020 Atlantic hurricane season.
On May 21st, NOAA issued its 2020 Seasonal Hurricane Outlook for the Atlantic and Eastern Pacific basins. For the Atlantic, a busy hurricane season is predicted. Here at NOAA, we're predicting a 60% chance that the 2020 Atlantic hurricane season will be above normal. There's a 30% chance of the season being near normal, and only a 10% chance of it being below normal. Overall, this year's outlook reflects several climate factors that are conducive to increased hurricane activity, including the ongoing high-activity era that has been in place since 1995. We are predicting ENSO-neutral or La Niña conditions, along with warmer-than-average sea surface temperatures in the tropical Atlantic Ocean and Caribbean Sea, coupled with reduced vertical wind shear, weaker tropical Atlantic trade winds, and an enhanced West African monsoon. Hurricane preparedness is critically important for the 2020 hurricane season, just as it is every year. Keep in mind, you may need to adjust any preparedness actions based on the latest health and safety guidelines from the Centers for Disease Control and your local officials.
Great. So hurricane season officially started on Monday, which was June 1st. And as you all just heard, NOAA is predicting that we're going to have quite an active season this year. We actually had 2 named storms in May before the start of the official Atlantic hurricane season. And then as of yesterday morning, as Matt mentioned a little bit earlier, we now have a 3rd named storm, Tropical Storm Cristobal, that formed yesterday in the Gulf of Mexico. So that's a storm that anyone that is along the Gulf Coast region, you're going to want to keep an eye on that storm over the next couple of days moving into the weekend. So what does that all mean for dialysis facilities? We understand that COVID-19 has likely delayed some of your usual hurricane preparedness activities at your facilities, but it's very important that we all plan now. So under the CMS Emergency Preparedness Rule, ESRD facilities are required to establish and maintain an emergency preparedness program that includes 4 key elements: an emergency plan, policies and procedures, a communications plan, and a training, testing, and patient orientation program. So there were some updates that came out to the rule back in November of 2019, and one of those updates included when the new changes came out last year were that facilities only need to review and update their plan every 2 years. We highly suggest that all providers take a few moments to review your facility's comprehensive emergency management plan and make any of the necessary updates and changes based on any of the lessons learned, as well as what you're currently doing at your facility in response to COVID-19. There are likely going to be some changes that need to be made to your plans. So you want to take those out, even if it's not on that 2-year cycle. We would suggest you take them out, look at them, and make any of those changes that you need to make based on the current situation with COVID-19. You also want to remain flexible. So things may change as we move through hurricane season, and it's important that you continue to remain flexible and understand that you may need to continue to update plans as maybe additional guidance or additional information comes out in regards to COVID-19. We want you to plan for your worst case scenario. So one of the really important things that you need to think about right now is reaching out to your backup facility. Don't wait to do this. Don't wait until there's a storm headed your way to make contact with your backup facility. There's a lot of items that you're going to want to discuss with them, including any changes to their policies and procedures based on the COVID-19 pandemic. So some of the items to consider when you reach out to your backup facility: will your backup facility be requiring that patients have a COVID-19 test before they will admit them as a transient during evacuations? So that's an item that it's very important for you to know in advance if that's something that the backup facility that you have an agreement with is going to require. Also, you want to talk with them about any backup or any policies and procedures that may differ from what your unit has related to COVID-19. So an example of that is maybe your facility does not require that all patients wear a mask while they are in the facility, but it's very possible that your backup facility may require all patients upon entering the facility to remain masked for the entire time they are there. So it's really important that you reach out to them in advance. That way you're able to educate your patients on how things may be different if they do have to go to a different facility for treatment during an evacuation. We hope that if you know these things in advance and that you can notify the patients of any potential differences, that may help prevent some of the issues that can arise from patients that may not want to comply with the different policies and procedures at these other facilities. Another item to consider is If your facility is currently treating COVID-positive patients or COVID patients under investigation, will your backup facility be able to accommodate those patients? Is that something that you're going to have to reach out to other facilities in the area to coordinate? Because it is possible that your backup facility is not treating COVID-positive patients. So these are all things that are really important for you to discuss now and not wait until it's too late for you to make other arrangements. You also want to ensure that all of your facility staff are educated and understand the facility's plans for the 2020 hurricane season. Any changes that you have to possible evacuations or backup facility, you need to make sure that all staff are fully educated on this and able to talk with patients about your emergency plans for your facility. You also want to ensure that the staff members have their own personal preparedness plans. There are very likely going to be some changes to their own plans this year based on COVID-19. You may have staff that previously had childcare arrangements that are no longer going to work due to COVID. So these are all very important items that your staff members should address now so that they are able to get into work and help ensure that the patients have access to treatment. Next slide. So patient education is another key component of disaster preparedness. We need to ensure that the patients are all educated on what to do, where to go, including instructions for occasions when the geographic area of your dialysis facility must be evacuated. Patients also need to know whom to contact if there's an emergency that occurs while they are not at the dialysis facility. You also need to ensure that patients are provided an alternate emergency phone number for the facility in the event that they are not able to get in contact with the home facility during a disaster. Some other tips that we usually give to providers is make sure that your phone messaging is updated. If you have any changes to your operating hours or that your facility has to evacuate or is possibly closed after a storm, you need to make sure that that information is updated so that when patients call in, they can hear those changes and also leave the phone number for who they should contact if they are in need of contacting a facility to get treatment. You should also post that same information on the doors of your facility in the event that there are patients that show up at the facility. Let them know who they should get in contact with while the facility remains closed. You also want to ensure that you have the correct current contact information for all of your patients. This will really help you when you're trying to get in contact with all of your patients after the impacts of the storm. Another tip that we usually give is that providers should advise the patients that they will be trying to contact them after the emergency. And it's possible that it's going to be from a phone number that they do not recognize. This is something that came up quite a bit during the 2017 and 2018 hurricanes. The providers were telling us that a lot of patients didn't answer the phones and possibly didn't have voicemail boxes that were set up. And they didn't answer because the staff members were calling from their own personal cell phones or using any means to try to get in contact with them. So advise them ahead of time that you will be trying to reach out to them and let them know that it may not be a phone number that they recognize. You also want to make sure that you have an understanding at the facility level of what each of your patients plan to do. Are they going to stay in their home if they don't live in an evacuation area? Will they be evacuating out of the area? So if they are evacuating out of the area, do they know where to go to get treatment if they do need treatment while they are out of the area? Maybe they want to leave the county or leave the state. Are any of your patients planning to go to shelters? This is an important component this year because sheltering in your community may be very different this year due to COVID-19. So you want to pay close attention to any local guidance about updated plans for evacuation and sheltering in your community. And be sure that you share that information with your patients. It's possible that the shelters that they're used to going to or planning that they usually plan to go to may not be available this year. So talking that through with them and making sure that they all have solid plans and that you guys understand what their plans are going to be as well. You also want to make sure that each patient is provided a current copy of their dialysis treatment prescription prior to any known event. So when the patient comes for that last treatment before the impact of the storm, make sure that they leave there with all of the information they will need to get treatment at another facility. That way, if anything happens to your unit and the patient has to go to another facility, they have all of that paperwork with them. Next slide. So some additional items to consider when planning this year. Have you contacted your local emergency management officials? So we know that it is a long-standing requirement that you must contact your local emergency management officials at least once annually, but we would really encourage you to have regular ongoing contact with them. There's really a lot that not only that you can learn from emergency management, but they can probably learn a lot from you as well. There tends to be some gaps in understanding of what dialysis facilities do and what resources they have available. So having those conversations on a regular basis can really help to close some of those gaps and build an understanding between the dialysis providers in your community and emergency management. And again, you also, very important this year, is to pay attention and stay informed about any local guidance and any updates to the plans that your community may have for evacuations and sheltering. We also highly encourage everyone to reach out to their local healthcare coalitions. If you are not a member of your local healthcare coalition, this is something that can be very beneficial to not only your organization, but to the healthcare community as a whole. So by definition, a healthcare coalition is a group of healthcare organizations, public safety, and public health partners that join forces for a common cause, for the common cause of making their communities safer, healthier, and more resilient. So by becoming a member of your local healthcare coalition, it'll really give you access to opening conversations with other healthcare providers in your community. They facilitate a lot of information sharing among the different partners, as well as local authorities. They can help facilitate resource support, as well as facilitating a coordinated response to incidents. So this is a really important item that we really encourage all of the dialysis facilities to get in contact with your local healthcare coalition and find out how you can become a member. You also should be keeping a close eye on the CDC website and reviewing any of the latest guidance on COVID-19 and continually kind of reassess how any changes in the guidance may impact how your facility is planning for hurricane season. And one last important item to note is with COVID-19, there may already be significant impacts to the public transportation system in your area. So it's really important that you look into any alternate arrangements for transportation now for your patients. A lot of communities, especially the coastal communities, they will shut down public transportation services to assist with hurricane evacuations. So this could have a huge impact on the ability of your patients to get to those treatments just prior to a hurricane or tropical storm, as well as right after the impacts of a storm. So that's another important reason to get looped in with your local healthcare coalitions. A lot of them have members of the public transportation system that are members of the healthcare coalition. So this will kind of get you in with them. And sometimes all it takes is having those conversations and building an understanding of what the needs are of the dialysis community. We've seen it work in other communities where the public transportation services just didn't necessarily have a full understanding of how dialysis providers operated just prior to a storm. And it just took a simple, quick presentation of how the dialysis providers treat all of their patients just prior to the storm's impact. And those transportation providers found ways that they can help accommodate those dialysis patients. So sometimes all it takes is just a conversation and building those relationships through those coalitions. Next slide. So we do want to share a couple of resources with you guys. That is our website up there at the top, which is www.kcercoalition.com. On that website, you can find a wealth of resources, not only on COVID-19, but we have a great deal of resources that are geared specifically towards dialysis facilities and dialysis patients on how they can prepare for not only hurricanes, but all hazards. We also have provided links to some other great resources that are available, which you can find links to all of these on our website as well. If you're looking to get in contact with the KCER program, any of our team members, you can find all of that information right on our website as well. Next slide. Okay, I'm going to turn it back over to Matt so that we can move on into the question and answer section.
Thanks, Keely. And before we jump into that, I do want to remind folks, if you do have any questions for Keely today or Bev, feel free to submit them in our chat window. We have received a couple so far, but we might have room for one or two more. So we encourage you to submit those questions as we get started here. We've got a variety of questions here, Keely. I'll just go in chronological order as they've come in. This person asks, they have patients who are hesitant to take immediate action when storm approaches. This is obviously referring to your planning slides. They don't always plan. What recommendations would you have for a facility to, I guess the question is to emphasize how important it is if they haven't already gotten it?
So I wish I had a good answer for that. We know that you can try to provide as much education as possible, but you may always have patients who are unwilling to evacuate or unwilling to take the steps necessary to make the plans that they need. I would encourage you just to continue to provide as much education as you can. Give them the different resources that are available. That we have some really simple checklists available on our website that make it pretty easy for them to develop a plan on a one sheet of paper, so it's not a booklet or anything that's going to require a lot of effort to fill out. So I would just encourage you to keep educating them as much as possible. But again, there's going to be times when there's just patients who aren't going to be interested in complying with certain components of planning.
Certainly. And a comment just came into chat saying, hope for the best, but always plan for the worst. Another question that came in, this is one specific to PD patients. Is there any way that people or patients can find out in advance if a shelter has accommodations for exchanges?
So yes, what you'll want to do is reach out to either your local emergency management officials or in some communities it's the Department of Health, and find out if they possibly have a medical sheltering program or a special needs sheltering program. That would be the first step. And then you can also ask what type of sheltering locations are available. So it's really going to depend on the community, what types of shelters are utilized. Some use schools, some use giant arenas. So again, reach out to your local emergency management officials because they will be able to provide you with information about the specifics of the shelters in your community.
Great. Thank you for that. This question got cut off a little bit, so I'm going to do my best to interpret what I believe was being asked. I believe it says that some facilities have eliminated or limited admissions of transients, and in the event of an emergency evacuation for storm, will providers be lifting those restrictions on receiving transients? I guess the question is, does any agreement like that exist because they're concerned that evacuees may be turned down?
So I can't really speak specifically for all of the providers. We have had some conversations with some of the larger providers in the community, and based on those conversations, it does not sound like there's going to be any issue with evacuees being admitted. during a storm. But again, this may be one of those scenarios where it's going to be on a case-to-case basis. But from the conversations we've had with providers, that doesn't sound like it's going to be an issue.
Okay. Do you know of any, and this is purely curiosity, a question came in as well. Do you know of any shelters, I should say, that are specifically geared towards COVID patients, or is that not something that's being done at this point?
I have not heard any specifics about a shelter that would be designated for COVID patients. Okay. But again, sheltering is a community-based program. So you'll want to find out at your county level what your specific county is doing for sheltering. There's been conversations about using hotel rooms, opening up additional shelters to allow more space for evacuees. So that really comes down to your specific community, what sheltering options they'll have available.
Okay, I bet that makes sense. And the next two questions we've gotten kind of relate to that, and so I think you've already answered them, but this question in particular is the phased-in approaches that are happening. We're in Florida here, for example, we're in phase 1 of reopening, and we're moving to phase 2 on Friday, it appears. Do you know of any situations where, and it is local, as you said, or regional, where shelters will or will not be available due to this phase-in approach? And I think the example provided here was that the schools that are typically used for shelters are not being used as schools right now. So would that have an impact that you're aware of?
Right. So for all the information that I've heard is that communities are planning to have options available for those individuals that do have to evacuate. They may change this year who they ask to evacuate, or they may ask individuals during a tropical storm to remain in their home if it was built after a certain year. But they are all looking from all of the information that I've received at different options for those individuals that do have to evacuate to a shelter. I have not heard of any communities that are just not going to have that option available because of COVID. Very good.
Very good, thank you. And a comment came in that to remind folks that in addition to the great resources that you at KCER have, that if there are questions like this, if facilities have questions like this, that their ESRD networks are also a resource and a point of contact to get clarification on those types of regional situations.
Yes, definitely.
Well, Keely, that's going to bring us to the end of our questions. I want to thank you for spending your time with us this afternoon. We really appreciate it, and we just thank you for the very helpful information that you've shared tonight.
Yes, thank you so much, Matt. And if anyone has additional questions, they can reach out to us anytime.
Wonderful. Thank you again. All right, so let's go into our wrap-up here. Before we do that, we just want to talk a little bit about the kidneyhub.org. This mobile-friendly web tool is chock full of resources such as COVID-19 emergency resources, transplant, infection, prevention, well-being, etc., as well as educational materials, and it does link to specific KCER resources as well. We'll tie that into today's talk. So if you've not visited the kidneyhub.org, we encourage you to go out and do so. All of those resources are available from that little menu up in the upper right corner that you see looks like 3 little lines, including the KCER resources that we just mentioned. So let's talk a little bit about our next Quicken Our events. We're going to be sending out some save the dates on these if you've not already received them, but our next patient-focused event is June 9th. That's Tuesday of next week, 5 p.m. Eastern. And our next provider-focused event is June 10th. That is Wednesday, 1 week from tonight at 5 p.m. Eastern. You can view information on both of those Quicken Ours, as well as topics and speakers, and a registration link at www.kidneycovidinfocenter.com. When you visit that page, click on the COVID-19 Quicken Our Events banner up in the upper right corner, and you can see any and all upcoming events that we would love to have you on. So on behalf of the NCC, I just want to thank you for your time this evening. Our contact information is here on the screen if you do need to get in touch with us. As Keely just noted, the KCER website, and specifically the COVID resources for the KCER website, are available at the URL that is displayed on this screen here. And again, our website for COVID resources at the NCC is www.kidneycovidinfocenter.com. Again, I want to thank you for your time this evening, and we hope that we'll see you on a future Quick&R. Have a wonderful evening.